And we're at a time, this is not unique in history, but this may be the worst time in American history in which so many people are losing their jobs very, very quickly. Some economists are expecting or predicting that we could lose as many as 40 million jobs by the middle of April. That's just an astonishing number, and who knows if that will actually happen, but some serious economists are predicting that job losses will be that significant, and along with that will be so many people, millions of people who don't have health insurance.
And Joe Biden during the debate said this is an emergency, and if it were me, you wouldn't have to pay for anything. I'm seeing online people tweeting out my Venmo for people to send money because my healthcare bills are out of control. GoFundMe's for healthcare. A lot of people going to the emergency room trying to get tested for COVID-19, but there are no tests. They're still getting stuck with the emergency room visit. So it seems to me, obviously he's not the president at this point, but this whole idea that this is an emergency so you won't have to pay for it, well, that's not in the bill that was just passed.
Right. Yeah, exactly. And you may recall that the President Trump said just 2 or 3 weeks ago that he had met with insurance company executives, and they had said that they would cover the cost of testing and treatment. And almost immediately, the big health insurance companies corrected him and said, no, we're not going to waive. In fact, he was just talking about waiving the co-insurance and deductibles for testing and treatment. But the insurance industry very quickly set the record straight and said they won't even waive deductibles and co-payments for treatment. It is ridiculous that our president and political candidates are where they are. And I can fully expect that we'll probably see the health insurance companies start begging for a bailout during the next bill that Congress considers. They already are asking for Congress to step in and help people pay their health insurance premiums when they are sitting on just piles and piles of cash.
And could you kind of talk about, in a better world, if we had Medicare for All before this broke out, what would that have done as far as preparedness, the availability of tests? What's the connection between, because Biden in the debate kind of put this notion out, well, Italy has universal health care and look how they're doing, which to me seemed nonsensical. It seems like
it is nonsensical.
Yeah, can you kind of talk about that?
It is very nonsensical because in Italy, yes, they've had a large number of cases and deaths. We're obviously going to surpass that by an untold factor. But they, at least in Italy, the people who live there don't have to worry about the cost of testing and treatment like we do. The other thing is that in this country, we have invested so little over the years in public health. We are very unprepared for this. So much of the money that we spend, about a third of what we spend on healthcare every year, which is last year was $3.6 trillion, 30% to a third of what we spend go to administrative cost and overhead and profits, which is not common, not at all common. We're an anomaly in the developed world in which that's the case. And so consequently, you've got all that money going to pay executive salaries and reward shareholders, and we've been pinching pennies when it comes to public health. So that's one of the reasons why we are where we are. We're very unprepared for this because of how we have allowed our healthcare dollars to be diverted into shareholder and executive pockets.
And it seemed to me it was just quite the scene. A couple of weeks ago, Trump's in the Rose Garden. He's parading out, the CEO of Quest Diagnostics, CVS, I think Walgreens, like these companies are going to somehow save us. Doesn't that kind of say it all, that we're relying on private for-profit corporations to make the necessary tests, ventilators, provide the mask? Obviously, either they're not equipped to do that or price is a consideration for them.
Exactly. And most of these companies are owned by shareholders. Their stock is traded on the New York Stock Exchange, or they're owned by private equity firms. And the goal is to make money. I can assure you of that because I spent 20 years working inside the insurance business. And I was the person who handled financial communications for Cigna for more than 10 years. So I know what motivates these guys. Vice President Pence and the president and others have talked about the so-called public-private partnership, and executives talk about bringing devices and drugs and everything like that to market. They use the terminology of Wall Street, bringing things to market. And we saw that Gilead, a big drug manufacturer, was planning and was promising shareholders that they would really price what they're working on at a very, very expensive price. I think they've backed off on that. But that's exactly what you have. When the motivation is profit, you have this going on in this country.
Right. And let me ask you, because they're talking now, some analysis is saying healthcare rates could go up as much as 40% next year just because of coronavirus. It seems to me if we could find estimates are different. That's okay.
I'm so sorry about that.
No problem.
So sorry.
That's okay.
I share my office with my dog. Charlie.
Now the viewers will love it. If estimates are this bill that just was signed could estimate into $4 to $6 trillion. If they could come up with the money for that, isn't this whole excuse of how do we pay for Medicare for All just exposed as an excuse?
Oh, it absolutely is, and it exposes the language that so many of our candidates, Democratic candidates, were using over the course of several months on the campaign trail and on the debate stage. They were using the talking points that I used to create, getting Amy Klobuchar and Joe Biden and Pete Buttigieg in particular, saying that 150 million Americans like their insurance, they love their insurance, they don't want to risk losing it, they don't want to get it replaced with Medicare for All. When in every state that has held a caucus or a primary so far, entrance and exit polls have shown that the majority of those, in every state, including Tennessee, where I grew up, and South Carolina, red states, a majority of voters said they supported replacing private insurance companies with Medicare for All. So what you had, those candidates obviously knew that, but they were taking money from insurance companies through campaign contributions. They were listening to their lobbyists. They were using their talking points. So we've got a situation in this country in which the Democrats and Republicans are on the take from the big entrenched special interest, and now we're seeing what the consequences of that really is.
And what I find striking is who determines what an emergency is that categorizes as this will pay for. So Biden says during the debate, this is a pandemic, this is an emergency, you won't have to pay anything. Okay, but people rationing insulin, that's not an emergency. People with stage 4 breast cancer, why is it? Is it the company you used to work for, basically, is determining what is the emergency worth paying for?
Exactly right. We have put the insurance industry in control of our healthcare system. They are the gatekeepers to care. They will say they don't deny care, but they absolutely do. When they deny coverage for something, it's denial of care. These are death panels inside insurance companies. I can attest to that. And why should we not then say that people who have, as you said, diabetes, who need insulin, people who are suffering heart attacks, people who need expensive cancer medications and treatments, why in the world should we just make one exception now that we have a crisis? Maybe this sounds harsh, but let's not let this crisis go to waste. Let's make sure that the American public knows just how irrational our healthcare system is, how cruel it is, how inefficient it is, and how we shouldn't just say that just for one diagnosis that the government should cover all treatments, when at the same time we're going to continue to have as many people diagnosed with heart problems and cancer and diabetes. It just makes no sense whatsoever.
And as these unemployment claims skyrocket, we just had a historic unemployment claim. We're probably going to have repeated records as more people file unemployment. They're losing their health care too. So what are those people supposed to do? It's not like you could just it's not like there's going to be a run on Medicaid and everybody's going to be granted Medicaid.
Right. Yeah, there are not really good options for a lot of people, because obviously when you are laid off, your paycheck stops too. You may have a couple of weeks of severance, but in many cases, I'm finding that people are not getting any money after their layoffs. And this will be people in the millions before this is all said and done. So yeah, it's crazy. And one of the other factors here is that because people have such, even if they have insurance, such big deductibles, such high out-of-pocket costs that they have to meet before the insurance company will pay a cent dime. You have people who are reticent. They're not likely to get tested or treated as they should because of the fear of the financial consequences. We're already seeing that. We're seeing that some people have gone to the hospital and have already gotten big bills from the hospitals for the ER visit that they had. So, word gets around. People are concerned, as they are in no other country, about how much it will cost for them to get tested and treated. And that is obviously going to be adding to the spread of coronavirus.
And let me ask you, let's say Biden were to become president, his plan, called expanded Obamacare with a public option. Would that change the current situation? Would a lot more people have coverage during a pandemic? Would bills get reimbursed for them if they get a bill from the emergency room for coronavirus? Because it seems to me, there's no price controls on the for-profit health insurance industry under Biden care.
No, that's exactly right. And details matter. He has thrown out this term public option, as some of the other candidates have too. What exactly does that mean? How would the public option be structured? How could it be put together in a way that people are not suffering the same problems, the same financial stress that they are with private insurance companies? One of the problems too, even if you were to create a public option and it's run by the government more efficiently and premiums are a bit lower, then you will have a rush of people, particularly people who have pre-existing conditions, into this public plan because they will see that it's somewhat less expensive. And the insurance companies will think, while they say they oppose this, they will rig the system. I can assure you this is what will happen, and it is why we are where we are right now, because they will say, well, we can cut rates for people by cherry picking those who we want to have in our business, our health plans, and that will happen without them actually having to do anything. The result will be that those who remain in private insurance plans, their rates might go down because those who are less healthy will be migrating to or enrolling in the public option. It will create, a lot of economists predict this, and I would imagine that it would be true, what's called a death spiral for the public option, in which so many people needing expensive care would be enrolled in the public option that you'd have to pour more and more tax dollars into the public option to keep it afloat.
And something that I don't think gets talked about a lot, but if you keep on these offering Band-Aids for a gunshot wound, well, legislatively, if Biden were president, okay, if he expands Obamacare, what happens when he loses both houses of Congress in the midterms, and then the Republicans start chipping away at it like they did Obamacare? So, exactly. The legislative body, that's why Kamala Harris's plan, if you want to call it that was like, it'll happen in 10 years, was so ridiculous. Because you're basically giving the other party and the lobbyists and all this just the ability and the invitation to just chip away through the courts, through legislative means, to sabotage your already inadequate proposal.
You're exactly right. And it is why the sponsors of the bill in the House that would create a Medicare for All healthcare system, one of the reasons why they wrote it as they did, to have a transitional period of 2 years, was partly because of what you said, for the concern that the change of leadership, change of control of Congress could change, and it often does, as we know, changes very, very often. So it's and also it can be done very quickly as well too. We had problems with Obamacare, with the exchanges being set up and people enrolling in that, and the sites crashed so often. We wouldn't have that problem because with those, you had multiple insurance companies, different ones in every state, different ones in every zip code, really. And all that had to be put in place. With Medicare for All, you have one system that's already been in place for 50 years, more than 50 years, and you could move people into a public plan that already exists much more readily.
And I know you haven't been in the private healthcare industry for many years, but take us inside those boardrooms right now. What are the conversations like? Blue Cross Blue Shield, Cigna, how are they going to try and capitalize on this? Because it always is disaster capitalism with these types of groups.
They're already smelling profits here, believe it or not. In fact, the CEOs of big insurance companies tell Wall Street financial analysts things they would not tell the general public. And we got a glimpse into that, and I knew it from, the 10 years that I spent handling financial communications for Cigna. Recently, we learned that the CEOs were telling analysts at Barclays Bank that they expected they might even have a net savings this year because of coronavirus. And their reasoning is that hospitals, and we're seeing this is happening, are already canceling a lot of procedures that are not life-threatening. So knee replacements, hip replacements, everything that is not life-threatening is being either postponed or canceled because hospitals are beginning to be flooded with coronavirus patients. And as long as they continue to have this posture of not waiving co-insurance and deductibles for treatment, they think they can come out smelling like roses. And if they do have an uptick in medical claims that they have to pay, one CEO, the CEO of Humana, said, well, we've got that figured out as well, too. We'll just increase premiums next year. And as you noted, we're already seeing the officials in California who run the California Obamacare exchange said they are expecting that premiums will go up 40% there. And that's one of the best managed exchange in the country. You can imagine what it's going to be like in other parts of the country. And if you think that that's going to be different if you have your coverage through your employer, you're fooling yourself, because they also jack up the premiums for people who have coverage through private plans through employers as well, too. So we'll see the same thing. There's no one who's going to be escaping this who has private health insurance without paying additional premiums. And more than likely, every year they've been increasing the deductibles as well, too. So it's going to get worse, and the insurance companies are going to get richer, and their shareholders are going to get richer.
United Corporations of America, as always.
Yeah.
Thank you, Wendell, President of Business for Medicare For All. We'll stay in touch.
Thank you, Jordan.
Okay. Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.